Hi there, my name is Tiana Priestley. My name is spelled Tianapriestley. Today I am going to be administering IV medication by piggyback. And before we begin our skill, we are going to do our very first check. So the first thing that we're going to do before we start anything is check our doctor's order to the MAR. So the first thing that we're checking for is that we have the right patient. So we're checking that we have Mr. PNL on the doctor's order and then Mr. PNL on the MAR. The next thing that we are going to be checking is our right medication. So we're checking pantoprazole on the MAR to pantoprazole here on the doctor's order. We want to make sure that we have the right dosage. So here we have 40 milligrams on the doctor's order, and then again we have 40 milligrams on the MAR. And then we're going to be checking the route. So it's going to be administered via IV. And here on the MAR as well, it is also going to be administered via IV. And then lastly, we are going to be checking the time. So on the doctor's order here, we are administering today 01:01:44, and then the time as well here 01:01:44, and we are administering it at 8 o'clock. So now that we've done all of our checks, we are now going to check that we have the right medication to the MAR as well. So we're checking here that we have pantoprazole, and again pantoprazole on the MAR. We're making sure that our medication is not expired, and then we are going to go on to be checking our mini bag. So we just want to make sure that the mini bag is also not expired, so everything is looking good here. And that is our first round of checks. Now we are going to sanitize the space. So we're going to make sure our workstation is clean. We're going to be sanitizing our area. We're going to sanitize and do hand hygiene to our hands before we begin preparation of our medication. So we've sanitized, we've cleansed everything. Now we are going to begin to prepare our medication. So the very first thing that we are going to do is we are going to be administering air into our vial. So before we start, we're going to cleanse the top of the vial, and then we are going to cleanse our port. And now we are going to be injecting 1 milliliter of air into our vial, safely removing the cap. We're going to be taking 1 milliliter of air, exactly 1 milliliter, and then we are just going to inject that into our vial, safely injecting. And now we are going to remove our medication. So we're going to be making sure we can see the part that is unlabeled. And we're going to be bringing the medication down, making sure that there's no air bubbles, all the way down to 1 milliliter here. Okay, so now we have 1 milliliter of medication. We are going to remove that, and we are going to be injecting that medication into our mini bag. So we're going to do that as safely as possible by keeping the mini bag on our workstation, inserting it here, and injecting the medication into the mini bag, safely removing, and we are going to safely recap. And this we are going to throw into our sharps bin. Next, we are going to evenly distribute the medication into the mini bag, and then we are going to label our label our mini bag with a new label. So we have a fresh label. We're going to make sure to label our medication on this side rather than on this side with the writing on it. So we're going to again check. We're going to add our patient's name, Mr. PNL, the drug, pantoprazole. We are going to be writing our correct amount. We are going to be doing the right date, time, and then we are going to be calculating our infusion rate. So in order to calculate our infusion rate, we're going to take the amount in the mini bag, divide it by the time that it's going to be infused, and then we're going to multiply that here by the amount of drops per milliliter, so our drop rate. So we are going to take 50, we are going to divide it by 30, and we are going to multiply it by 10, which is going to give us 16.66, otherwise 17 milliliters as the drip rate. So we're going to label that on our mini bag. It's going to be, our infusion rate is 17 drips per minute. Now that we have everything prepared and cleansed, we are going to enter our patient's room with our supplies. So we're going to bring the MAR inside, we are going to bring our mini bag, and we are going to be bringing our mini bag, our primary bag, which we don't have today, so this is what we're going to be using, and we are going to be bringing our ports, and then we are going to be entering our patient's room. So we're going to enter, we are going to knock on the door, come inside of the patient's room, assemble everything, and then the very, very first thing that we're going to do is perform hand hygiene upon entering the patient's room. So we're going to cleanse our workstation, cleanse our bedside table, perform hand hygiene as I'm entering my patient's room, and then I'm going to introduce myself to my patient. So everything's cleansed. Coming to the bedside, I'm going to introduce myself. Hello there, Mr. PNL. My name is Tia. I am a first-year nursing student at Seneca College. Today I am going to be administering your medication, your IV medication, via piggyback. Before I start, can I please confirm your name and date of birth, and I'm going to check the patient's armband. So here we have Mr. PNL, his date of birth, and we are also going to be checking if there are any known allergens, which he does not have any known allergens. And now I'm going to be checking the IV site for any signs of infiltration. I'm going to be checking for any redness, edema, swelling, or allergic reactions. Everything on the site looks good, and so I am going to now begin to prepare my medication. So I'm going to go back to my bedside table, and before I begin to administer anything, I am now going to be doing my third check. So I am once more going to be checking the medication that we have. So Mr. PNL, we've confirmed our patient. It's the same patient that we have on the MAR. We are going to be administering pantoprazole, so we're checking the MAR, we're checking the medication, we are checking the route, we are checking the dose, and we again are checking the time and the rate. So everything is matching up according to the medication in comparison to the MAR. We are ready to begin our medication administration. So, let's see here. Before we begin, I am going to cleanse. I'm going to cleanse my port. I would open this in a sanitary way. And then we are going to be, I'm going to make sure that this little part here is closed. And then I am going to be spiking the mini bag. So I'm going to pop this off, cleanse, and then spike. And now I'm going to be able to hang the mini bag, keeping in mind this is closed, like I had said before. So we're going to hang the mini bag below the primary bag. And I also want to double check that the medication is compatible with the primary bag. So I would have checked that before I came into the room. I'm checking it for a second time now that the two are compatible. And now I'm going to prime the mini bag. So in order to do that, first of all, I am going to close the primary bag. So I'm going to close the little port on the primary bag. I'm going to cleanse that port as well. And then I would have done all of that beforehand. And now I'm going to prime this bag. So we're gonna open this up just a little bit. We're gonna watch the solution go through. We're gonna make sure there's no air bubbles as we prime. Everything's looking good. Perfect. Okay, so we have the line is primed. Now we are gonna connect the cleanse port to the primary bag. So we're gonna connect the two. And then we are going to double check the drip rate. So we had said previously that we would be infusing this at a rate of 17 drips per minute. In order to double check, we are going to divide that time by 4. So instead, we are now going to be checking to see 4 drips infused over 15 seconds. So we're going to double check the drip rate. We're going to do that by bringing the solution out here, and we're just going to watch 1, 2, 3, 4. So that's correct. So now we're going to hang the bag here, and we're going to document everything that we did. So we're going to go back. We're going to document. We are going to sign our initials on the MAR that we distributed the correct medication. We're going to wait for our medication to infuse, and then afterwards we are going to disconnect the mini bag, reconnect the primary bag, and we have completed our first skill.